Hello, welcome back to my channel. My name is Neate Physio and I'm a physio who specialises in cancer, and today's video is for breast cancer patients who are 10 to 12 weeks after surgery, and that could be any surgery from lumpectomy, mastectomy to any sort of reconstruction. These are very quick, simple exercises that you can do for the next 2 weeks to not only get your range better, but to actually start strengthening so that you can get back to the hobbies or sports that you enjoy. But first, a quick disclaimer. Everyone has their own medical history, social history, physical abilities, or cancer treatment plan. So check with a medical professional before starting any type of exercise, and really, we just don't want to push into pain. The key focus during this 2-week period is to finalise your range and to start to add on that strength and really starting to build so that you can get back to certain sports and hobbies. And when I talk about full range, what I mean is taking the arm all the way up, all the way out to the side, all the way out into rotation, and one of the hardest ones, getting one or both hands behind your back. Now, for many of you, you will not be there yet, so please don't be disheartened. Everyone is on their own cancer journey, and depending on your own medical history or cancer treatment plan, you may be at a slightly different pace. That's not a problem at all. What I would suggest is if you're struggling with range still, stay on the 8 to 10 week exercise program, so the video I've made during that period, because it does really focus on mobility to get you those ranges back. You can add on some of these exercises, it's not a problem, just don't overdo it. Now, the exercises for the next 2-week period really shouldn't take very long. We've got 3 exercises that are a warm-up and to help stimulate that lymphatic system, to help remove any fluid or edema that's still there. And then 4 bulk exercises, which are primarily strength, with one little stretch to finish. So really, they might take you a couple of minutes. I tend to recommend little and often is best, which means trying to do them at least twice a day. However, 2 to 4 times is ideal, but never ever push into pain. All the exercises can be done on your back, sat in a chair, or stood up. So really, you can do it anywhere, even if you are starting back at work. All you're going to need is some kind of resistance band. If you haven't got a band, do use a free weight such as a can of beans. However, I do suggest getting a band because a band gives you sensory feedback, so you can use a whole mixture of muscles, whereas sometimes with a free weight we have a tendency to bias and use what is strongest, and that can cause some postural changes and things that could contribute towards pain. So the first thing to do when we warm up is activate that lymphatic system. So all we're going to do is 5 shoulder rolls forwards and backwards, but adding in breathing, and that's going to try and help shunt that lymphatic system to help remove any fluid. And you can follow along with these exercises in real time, or just save them and copy the exercises in your own time at home. So we're going to inhale, roll our shoulders forwards and up to our ears, and exhale, drop back down. Inhale, roll up, exhale down, inhale up, exhale down, inhale, exhale, last one, and exhale, and back the other way. Inhale, back and up, exhale, forward and down. Inhale, exhale, inhale, exhale. 2 more times, and really think about getting as much shoulder blade movement as possible. We're really trying to move that shoulder blade around the back. And relax. The second exercise is a side bend. So we're just taking ourselves side to side. If you've got a lot of shoulder pain, I would just keep your arms down and just focus on the movement. However, if you want to work on it, take your arm up as far as you can, but just don't push into pain. A lot of people get a bit of an impingement around this point. So just go to that point that's okay, but not painful. So inhale, and then side bend, exhale. And back down. Inhale, exhale, and really think about reaching up nice and tall. Exhale, last one, and exhale, and back down. Really good. The final warm-up exercise is best done against a wall because it stops us cheating or compensating. However, you can just do it anywhere at all. Just find a position where you're not allowing your shoulders to fold forwards. If you need to really think about drawing your shoulders back, but all you're going to do is pop the roof of your hand against the wall at a comfortable height, and again, not going into pain. You're going to inhale, take your whole body back against the wall and relax because this works on our posture. Try and tuck your chin in a little bit, and you're just going to inhale as far up as you can and back down, and just do 5 of these. So inhale as far as you can go and back down. 3, almost there. 2 more. It's harder than it looks. 4, exhale. Last one, inhale and back down. Honestly, it is quite a challenge, particularly if you're someone that's finding you're struggling to reach to get your phone on your bedside table, your light, because we need this movement pattern to do that. So it's a really important one, but just don't go into pain, which might mean you only get halfway. Just keep working at it. It will get easier. Now you're going to need to bring your band back into play here to work on strength. The first strength exercise, we're going to keep our elbows into your side, your palms facing the ceiling, and the goal isn't pulling apart, it's trying to squeeze your shoulder blades together. You want to work up to 10 repetitions, but you might initially just do 3 or 5, not a problem. Again, we don't want to cause any pain. So we'll do them together. Squeeze and pull apart, squeeze the shoulder blades and back in. 1, 2, 3, lovely. I'll show you from side on. 4, and really think about drawing the shoulder blades back and down the spine. 6, 7, 8, 9, and 10. Fantastic. The second exercise is very similar. This time we're taking our arms with straight, thumbs towards the ceiling, and we're just going up as far as you can, but again, not into pain. And again, we're working up to 10 repetitions, but you might start with 3 or 5. Just follow along, and again, I'll show you from different positions. So pull the band apart, and at all points, try and keep that band taut, but not with full force. I'm looking at about 20 to 30% tension only. Nice and steady, take your arms up as far as you can, and keep the tension on as you lower. 1, this one's one of the hard ones. 2, keep pushing, and just go at a pace that feels comfortable for you. 3, 4, well done, keep going, it's hard. If you need to stop here, stop here. 5, 6, 7, almost there, 3 more. 8, 9, keep going, last one, and 10. Really good. That one's quite an ache, so don't be alarmed if you need to take it down a notch. Even with me, and I haven't had the surgery, it aches my shoulders, so start at a lower repetition. The final banded exercise then is we're going to take our arms up to shoulder height and back down, not any higher because we don't need to cause any impingement. I would keep one hand by your hip. Again, try and keep your thumb towards the ceiling because it's going to encourage your arm to rotate away from you, and that's going to reduce any pinching pains. And have the band laxer than you think. And again, working up to 10 repetitions, but you might start off with 5 on each side, not a problem. I would do both shoulders, even though one might have not had surgery, because it's good to just build up a bit of symmetry. So, 1, 2, 3, 4, 5, 6, keep going, almost there. 7, 8, 9, and 10. Really well done. So the final movement then is working with a doorway if you can. If not, just do it against a wall or I'll show you a different variation. But the doorway really pushes the stretch. So it's really common for individuals to get chest tightness, and then that can cause pain and pull the shoulders forwards. And if you look in a mirror, you might notice that one shoulder's kind of dipped forwards and down. This is to try and help reverse that, so try and correct that posture. So starting at a lower level when you first do this, keep your elbows in by your side, hands against the frame, and then you just want to lean yourself in. Now, when you're at a low level, it will feel okay, but slowly you want to work in taking your arm up a little higher each time, and ideally the end goal is for the arm to get up to about shoulder height. When you do that, trust me, you'll feel it. Now, leaning forwards can sometimes be quite a powerful stretch and actually cause pain. So I would just lean in gently and never into a wince. You want to lean in, and actually, for this movement, you would only do it 3 times, but each time hold for 30 seconds. And that's because we want to lengthen the muscle fibers. So we're not just mobilizing, we're actually trying to stretch out that muscle. So standing here, holding for 30 seconds, 1 to 3 times, and doing that a couple of times a day, it won't take long for that muscle to loosen off. If you're someone, however, who finds that stretch too challenging, or you're at work and you don't get access to that door, then all you're going to do, either putting your hands on your shoulders or behind your head, keep your hips forward, so no cheating, no twisting for your hips. You're just going to twist your mid and upper back as far as you can, back in, and the other side. So you can see I'm actually not moving very far because I'm not using my lower back to help cheat the movement. So we're still stretching out our chest, but we're also getting a bit of a stretch to our mid-back. Again, you can't really hold for 30 seconds so much because it's a bit of a strain. So I would just do 3 each way, just to try and mobilize the muscle as best possible. There you have it, your simple couple of exercises. As I said in the beginning, just doing it 2 to 4 times a day and just never push into pain. So finally, we're just going to move on to the final section, which is just some brief advice on how to self-manage any specific symptoms. The first thing here is scar therapy. So if you haven't watched my 8 to 10 week video, please watch it. Go along to the end because I go into detail about scar massage, but you should be doing scar massage during this time frame, and to be honest, probably for several months. Scar massage is really important because it's going to break down any scar tissue and fibrotic tissue around where the scar line is, and the breast itself, and even into the armpit, so that the tissue can become as smooth as possible. We can't get rid of all scar tissue, but the more you can do during this acute stage, the better. The second thing that I did talk about again in that last video was on signs of lymphedema. Lymphedema is a condition that if we catch it early, sometimes now the research shows it could be preventable. So if you notice any fullness, pressure, fluid or skin changes down the arm or into the breast, let your nurses know, because if so, you can get referred to a specialist team. The other thing that happens quite often during this stage is our bodies are now starting to heal and regrow new tissue. And one of the things that I get a lot of questions about is the fact that you're getting some shooting pains, burning, stabbing, itching, weird little sensations like that. And often those sensations are occurring because you're getting new little nerve stimulation, essentially. And when nerves are irritated and not quite getting enough oxygen, they basically send warning signals, which are all these altered sensations. The only way we can really speed up this process and make it more comfortable is to gently touch the area. So in addition to doing your scar massage along the actual scar itself, what I want to encourage you to do is very light touch around your breast and into your armpit and even down the arm, and especially if you've got an area that feels numb. We might not be able to get rid of all the numbness, but we can certainly improve it. I would do it twice a day, so morning and night, 30 seconds to a minute, no more, no less. You don't need a cream, although a cream can be helpful because it's quite soothing, and all you're going to do is very gently, light touch, circular massage around the breast, into the chest, into the armpit, down the arm, and wherever you're feeling those altered sensations. The other thing you can do, which is a scar therapy technique, is brushing. So in addition to that gentle circular massage, either with the tips of your fingers or your knuckles, just lightly brush over the area, and very, very light, so that it's almost tickling. If you did it on your hand, you would go, oh, that feels quite ticklish. You're just going to be going over the area, into the armpit, and just, again, 30 seconds. And it's just going to try and stimulate those nerves to learn what normal sensation is and to try and correct it a little bit quicker. It also encourages your body to heal more efficiently because you're trying to get blood and oxygen to rush to the area and actually focus on that healing process. My final thing to say, though, to you is going through cancer treatment is an incredibly challenging time, and you're all going through your own unique journey. So follow the advice and the exercises as you best can, but please be kind to yourself. Our bodies heal at their own rate, and unfortunately, we all want to be back really, really quickly. And the reality is everything takes a long time to heal. So please be kind to yourself, and I will see you guys in the next video.